So we are back with another video on baby eczema. Now this is something that was new to us as parents, and we did not know about if this was even a condition. At the first time when it appeared to our baby was around like 3 months old, and we thought that it is actually diaper rash because it was in that area, in the diaper area. This video is going to help you with conservative measures and home remedies to help it manage it better. Conservative, very important. Always do a patch test on your baby before trying any of these remedies, because what worked for my baby might not work for you. And also chose a lot of moisturizers, toggled between them, and there will be a separate video on which one finally worked. Again, every baby has a different kind of a skin. Do what works for you. Do stay on till the end, because the most important tip for baby eczema that we realized in this course of 2 years is at the end of this video. So let's get started. Like always, I have divided this video into process and products that I have used on the baby in terms of managing it in a conservative manner. Now, what you need to understand is that these have worked for my baby. Choose what works for you. And having said that, even after doing all of this, there are flare-ups, there are still areas where it is still itchy for him and there is still eczema, but we try to manage it as conservatively as possible. So let's talk through the processes. The first thing that we try to do for him is keeping nails short all the time as much as possible, because there's a lot of itching at night and we can't control that. We're not putting him on full sleeves clothes, so putting him on full sleeves clothes during the night if it is okayish weather and we put on the AC. We also tried putting a humidifier, but because it had a light and it was distracting for the baby, so we stopped doing that. But that also helps a lot of parents. The second thing we started doing for him was started making him put on socks, because the primary area that he was getting eczematic rashes, and he still does, is the fold between the feet, the foot and the leg. Bath short. Now this is something that doctors tell all babies with atopic dermatitis and with eczematic conditions, that keeping bath as short as possible. And while you're just patting them dry, leave a little bit of moisture on the skin and put on the moisturizer. So whatever moisturizer you're using, which would generally be hypoallergenic, so it might be a Cetaphil or any other, like an Aveeno or any other moisturizer that your doctor has prescribed, use that immediately after bath. Now let's come to products. So in terms of products, that something that worked really well was aloe vera, our good old aloe vera. So what you do is you just extract the gel out of this leaf and you put it into a bottle or a jar, mix it with some water, and either you can put it in a spray bottle. So we used to do that when he was younger. And with every moisturization, so we used to moisturize him at least 3-4 times a day. So before every moisturization, we used to spray this on his, like, primarily his problem area. This aloe vera gel, like, this is the most pure that we could get in our country, and I'm not naming the brand here. Just go for like as pure as possible, and the green colored aloe vera gels are not pure. The second thing which helped was breast milk for some period of time, and it has been proven also that breast milk has helped in a couple of studies where they tried to test breast milk application on eczematic conditions, and it has helped reduce the baby eczema a little bit. Helped is our old gold cold press coconut oil, virgin cocoa oil. Just 10 minutes before the bath, we did a light massage and then we put him into the bath. So we don't let oil sit on his body for a very long time. Just 10-15 minutes is okay. And as he started growing older, we realized that massaging has become even more difficult. In terms of clothes, put them on breathable fabrics, cotton clothes, invest in really good clothes. The thing that has helped us manage it conservatively is oatmeal bath. What we used to do is we used to grind oats, like regular oatmeal, grind it and then just keep it ready. And we used to give him like oatmeal bath once a week sort of, when the eczematic rashes were really high. And you just have to remember that this has to make the water really slimy. So put it into the bathtub, and the quantity should be such that it makes it really slimy. If you don't have this, then I would suggest you go for colloidal oatmeal. It is quite expensive and we have not personally tried it. And another tip in terms of products is that try to use soaps as minimum as possible and use only hypoallergenic soaps. So in our case, we were using Derma which is available in India and which was prescribed by our dermatologist. Third P, so we talked about processes, we talked about products. Now the third P is patience. It does get better over time. Ignorant as parents, and the baby skin was also very sensitive. So at 3 months, the rashes were really bad on his stomach, on the folds of his skin, behind the knees, and then on in front of the ankles. Now, as we started getting older, at 1 year mark it got better. At the 2 year mark it also got better. But having said that, he still does have it. It is also said it is genetic in some cases. So if you or your spouse has a history of any kind of allergies, it might happen that this is because of that as well. But you can't change anything about it, right? So you can only manage it conservatively. Come to the next most important tip: identifying food allergies. This is so important in terms of eczematic conditions, because you would realize that even in case of adults with eczema, they always talk about food allergies, and it can be anything. It can be from egg, soy, or peanuts, or anything like that. And in our case, we realize that whenever we give our child an egg, that is when the flare up is extremely high. Once you start solids, and even while you're breastfeeding, identify if there's something that you took in your diet that actually got him or her to flare up. So with that, I come to the end of this video. I will make another video on what are the products that we use, and finally there is a certain product that actually got this thing to get better. Every child is different. Every child has a different kind of a skin sensitivity. So do what works for you. I hope this video was super helpful, and thank you so much for watching.